Good afternoon, everyone. Good afternoon, good morning, good afternoon, good day, depending on where you're joining us from. Can you hear me? Please confirm you can hear me.
Yes, we can hear you.
Yes.
How are you?
Fine, we can hear
I'm
you.
well,
Thank
thank
you.
you. I trust. Okay, thank you. Thank you. It's so good to have you here. You are welcome to the March edition of Quality Conversations. My name is Yota Fadipe. And just before we get started, I just want to remind us of a few housekeeping rules to guide our time together. It would be great if you have your mics muted, particularly during the presentation part of this webinar. Maybe during the time for Q&A, you would given the opportunity to unmute to speak. However, you can make use of the chat to not only interact with the facilitators, but also to connect with other people. I'm happy to inform you that we have a global audience here, so you can use the chat to network, interact with other health professionals like yourself to help you along your journey professionally. Without further ado, I will hand over to Mrs. Nene Oche, the Managing Director of QBS Global. Thank you.
Hello and welcome, everybody. Welcome to March 2025 edition of the Policy Conversations. And I'm glad to have everyone in here. We are having a conversation on quality improvements in healthcare, and it's definitely going to be a robust one today. We're having a little bit of technical challenge, unfortunately, with our guests, but she'll be in a short while. Okay. Meanwhile, we'll just run through a bit on what healthcare, on the essence or the essentials of healthcare improvement. Meanwhile, I'd also like to know how many of us are into quality improvement within our healthcare organizations. So you can just add to the chat quality or QI, just say QI, and then I'll know that your core, meaning that your core role, 80 to 90% of your work is around quality improvement, is around improving the quality of the healthcare organization within which you work. So just use the chat and type in QI, and that will also know that the Q&A and the chat is working for you, or they are both working for you, and you can see. All right. So I haven't seen anything yet. So just like QI, we just would like to know how many of us are in active quality improvement. Okay. I'm just going to pull up the slides. Okay, so we have okay, fantastic. So we have quite a number of us. Nice to know. Okay. Great. Okay, great. So we are intentionally differentiating this month all of the quality control, quality assurance conversations we've been having before now, and we're taking a deep dive into healthcare, because quality control and quality assurance within the very technical section, or within the very technical arm of the healthcare industry, given by medical laboratories or presented by medical laboratories, science, and all of that angle, is very different or requires a different strategy from quality improvement. Quality improvement requires a different strategy from the quality assurance and quality control that is deployed within the very technical parts. Understanding the dynamism of the dynamic nature of the healthcare provision, the service provision, understanding that we have so many internetworked or interconnected disciplines that depend one on the other, as compared to the quality assurance, quality control that is pretty much streamlined, wherein you can make an intervention in one side and at a strategic point and significantly impact positively or negatively the outcome of the results that are generated or the outcomes that are generated within the system. It's quite different in quality improvement, as we may have experienced. Coming up with a quality improvement initiative, coming up with a quality improvement plan, coming up with and deploying this quality improvement drive that affects your entire system, that affects the pain points of the individuals within the system, the stakeholders, either from the internal perspective, from the external perspective, being your patients, is a whole new ball game. And many a times we find that healthcare professionals are different touch points within the service delivery, interface with the challenges that and the pain points of the patients. But solving these problems are not they're not as easy as waving a magic wand, because of how interconnected the different disciplines are, because of the different factors that affect each of the entire service provision. So managing a patient, from the clinical angle, or using clinical guidelines to manage a patient does not solve every other problem, does not, that narrow, that single part does not solve every other, does not prevent the patient from having a negative experience across every other part or some other part of the entire healthcare provision, or service delivery. So we are here to help us to see how to detect, how to pick improvement opportunities, how to deploy them effectively. And the deployment starts from the small parts and expands into the scaling up, into the spreading, as it's called in quality improvement terms, and how to sustain it within the system. So once again, welcome to our session. Anne, just want to bring Anne up. I'm just going to read her. Okay, she's not been able to come in. So while I wait for her, she just sent a message again saying it's popping her out, but no problem. Would keep on we'll keep on this conversation until she comes in. Now, I have good news for us. First of all, thank you for registering. Because you registered, you are here. We received quite a number of questions around when we asked what would you like information on, and what challenges are you having that you like to find improved within your system. We received a wide array of responses, and that was very encouraging. It was very encouraging to see that many of us, most of us, in fact, I don't think that I saw any response that did not have that question field. So there are places where people are facing challenges and have identified that, okay, I know that we need to improve on this, but I really can't figure out how to solve this problem. And so I realized that for us to answer all of these questions from over almost 200 plus people will be very difficult to achieve it within our webinars. So what we've done is to come up with our podcast series. So we are going to be answering the questions weekly. Okay, she's here. We're going to be responding weekly to our questions through our weekly podcasts. So we are going to send you an email to let you know once the podcasts are up. Our first 3 questions we are responding to the questions. We had quite a number of questions on root cause analysis. We had a number of questions on external quality assurance or control, and PDSA, PDCA, and cycles. So those are the first 3 questions we're going to be handling in the first 3 weeks, in the next 3, across the next 3 weeks in the podcast series. So watch out for the emails. Add us to your safe senders list so that you can receive the emails spot on, right on time when they are sent in, and then you can have responses to your questions. So we'll be treating quite a number of them together. And I'm really excited about that because that gives us the opportunity to touch base with everyone. So welcome, Anne. I'm trying to find you. I see that you've come in. I'm just trying to find you in the green room here. Yeah, I can see you. Hi. So you can.
Hi, Grace.
Hi.
Sorry, I'm having a challenge with my network.
No problem. Okay, so welcome. I'm just going to bring you up. And you can turn on your camera when you're ready. Okay, fantastic. Right, so good to have you.
Thank you, Grace.
Yeah, you've been calling me Grace and I've been enjoying it. Let's use Nene for the sake of this, but can you say Nene? So
Nene.
yeah, thank you. All right, so we're going to just head quickly in to the conversation, and it is my pleasure to read Anne's bio for us, right? Anne is a healthcare quality and risk management expert with experience across public, private, and faith-based healthcare settings. She oversees quality improvement, risk management, and compliance with ISO 9001:2015, ISO 15, and ISO 15189:2022 at Kenyatta National Hospital. She is also experienced in Joint Commission International, JCI, accreditation, and College of American Pathologists standards, and holds a master's in health systems management and a bachelor's in medical laboratory sciences. She's a certified ISO 9001:2015 lead auditor, specializes in risk assessment and quality improvement. She also serves as national treasurer of AKMLSO. So that's for the Kenyan Association of Medical Laboratory Scientists, with research contributions in laboratory accreditation and blood transfusion services. Please, let's make welcome Anne to the stage. Anne, welcome. It's so good to have you on.
Thank you, Nene.
Yeah, Blessing, I can see in the chat that you're unable to hear. A member of the team is going to provide support to you. I can hear Anne, and I think Anne can hear me clearly. And I was able to hear other people, so it might be something with your network. All right. So Anne and I have recently met through a mutual connection, Dr. Lydia, who is one of the big bosses in Kenyatta National Hospital as well, who we met at a healthcare conference. So Anne, welcome. Tell us a bit, before we delve into the questions, do you want to tell us a bit about your experience over time? What has it been like? Just tell us a bit of your story. How did you come into quality improvement? Just give us a bit of background into you beyond the official formal bio.
Okay, thank you, Nene, and good evening, everyone. As you have heard, my name is Anne Njeri Mbuthia. I'm a Kenyan working in Nairobi, which is our capital city. My career journey started in the medical laboratory field. I'm a trained lab technologist with a degree in medical laboratory sciences. And I started my journey in a faith-based organization where I was employed as a laboratory technologist. So that is where I first had my first encounter with quality, because most of the quality systems actually in healthcare started in the laboratory. So back then there were no ISO or other standards in Kenya, and the first encounter with quality was through training by an organization called Walter Reed by the US Army, and that's where I learned about quality assurance, quality control, standard operating procedures. And when I went back to my organization, I implemented those ones, the standard operating procedures, QC and quality control. We started doing method validations, and that was my first encounter with quality. We saw improvements in terms of the quality of our results, and also reduction in the errors in the laboratory. And I got quite intrigued by quality at that early time. Then I moved on to a different organization. And in my second organization, still as a quality person, this time in a state-of-art hospital, which was a much larger hospital. And it is there that now we started implementing the ISO standards, the College of American Pathologists standards, and hospital-wide JCI standards. So by this time I was in management, and so I got more involved in quality, but I was more interested in quality than before. And I gained more experience in quality. So that's how my journey started, and that's how I got involved in quality. Then later on, I moved on to a public hospital where I am currently. After doing my master's in health systems management, and of course, a lot more trainings on matters quality, such as the ISO audits, where I became an ISO auditor. I've done a lead audit in ISO 9001, ISO 15189. And so currently I am heading quality in a public institution. So in a nutshell, Grace, that is my background on quality.
Fantastic. Thank you very much. And I trust it has inspired some people who want to actually go. I get this question a lot. How do I go into the field of quality? How do I go deeper? I want to just sit in quality. You know, that's a story that I believe can inspire us. Great. So let's delve. Let's go deeper. Let's take the conversation deeper, right? So I'm just going to put the questions on screen as well so that it's easier for everybody to see. So tell us, Anne, from your own experiences, you know, what exactly is quality improvement? So you've had this experience over quality control, quality assurance, and you've actually walked the journey through ISO standards all the way into JCI and then healthcare standards, the IEA accredited standards. So now, can you tell for people who are just entering into institutions or public health institutions, what exactly is quality improvement and why is it crucial for patient care?
Okay. I would say first we need to have a clear definition of quality. You need to start with a clear definition of quality. And when it comes to healthcare, I prefer the definition that is provided by WHO in 2018 that defines quality of care, saying that quality should be safe, effective, timely, efficient, equitable, and patient-centered. So when you talk about quality in healthcare, it goes beyond just the clinical outcomes, but you need also to be looking at keenly the patient experience. Are you being fair? Are you being efficient? So first understanding, having a clear definition of quality in the context of operation. So why is it crucial? Because it will determine the outcomes of the patients. When you have poor quality, then you end up with poor outcomes. If you fail to have operational efficiencies, then you may not be able to sustain providing quality. So understanding this multi-dimensional definition ensures improvement efforts target what truly matters to patients and to healthcare systems. So that's what I would say in that context.
Fantastic. Thank you so much. You've basically talked about the 7/6. So it's been toggling between 7 and 6, but it's all semantics, but it's the domains of quality in healthcare, right? So you're talking about healthcare being safe, being equitable, being timely, and all of that. And that's those 6, 7 domains of healthcare quality is what feeds into quality improvement. Thank you so much for that. Now, when we look at quality assurance and we look at quality improvement, sometimes it's a bit, the lines seem a bit blurry, right? The lines seem a bit blurry. The approach to quality improvement and the approach to quality assurance, how can you distinguish, how can you set them apart? How can you distinguish between them? What would you say are the main strategies that make quality improvement different significantly from assurance in itself in everyday problem solving within the healthcare setting?
Mostly when we talk about quality assurance, it's mainly compliance focused. You'll find we'll talk about quality assurance when we are aiming to ensure that we are maintaining existing standards or policies or procedures which we are following to maintain a certain level of quality.
Yeah.
For example, if you are already certified or accredited, or even if you're not, you find that you already have some standard operating procedures that you are aiming to continue maintaining. So you are measuring your performance against a certain standard that you already have.
Yeah.
And in quality assurance, you are aiming to detect and correct problems.
Yeah.
You want to make sure that the services are meeting minimum quality requirements. So you've already defined which are these minimum quality requirements. And you will find in quality assurance, you will involve such activities such as probably auditing, or you're doing inspections, you're carrying out assessments, you're monitoring. So those are some of the things that probably you'll be looking at when you're talking about quality assurance. On the other hand, when you talk about quality improvement, I would say it's a more proactive activity, and it's more continuous process that focuses on identifying gaps. So I would say it is less, maybe you could say the word formal. It's a more informal method. You're testing changes to improve processes, outcomes, or patient experiences. It's more involved in process improvement over time. And the method that you'll use here, probably you'll be talking about the data-driven methods like the PDCA cycle. Yeah, so that's what I would say. I don't know whether I've answered your question.
Yes. Yeah, indeed, because you are having, like you've rightly said it, that when you're looking at quality assurance, you're looking at it from a perspective of standards. You're looking at this, this compliance, is saying how well did we adhere to the standards. So we have the standards. It's more going towards the technical parts that are very, very streamlined and structured. But you have this, like you said, this informal part where you have it, you're looking at what the day-to-day reality is. You're solving the problems that are meeting the people. You're seeing it, and you're saying, okay, this is before this de-escalates, before this becomes something else, how do we prevent it? Because we've seen what has happened before time. We can forecast and see what could probably go wrong, in the future, while the assurance just looks at, okay, what have you done? Retrospectively, what have you done? And have you been able to comply or not, you know, in the assurance part? And maybe that's why we can even talk about how the technical parts are delving into TQM and total quality management, so that it takes the attention off the streamlined quality assurance and brings that broader perspective that quality improvement brings. Actually, where you have some synonyms, just for the sake of the audience, you have these words being thrown about, but generally essentially mean the same thing when you're talking about quality management, implementation science, and quality improvement. They're generally talking about the same thing, but they differ, right, from quality assurance, like Anne has helped us to see. Thank you so much for that. And yes, you did actually answer the question. Thank you. Okay, now, looking into your experiences, right?
Yes.
Can you just give a high level? Don't go too deep, because at the end, we'll now talk again about an example of something that worked and all of that. But can you just share from all of your experiences, one that stands out to you, or one that you can recall very easily, of a quality improvement initiative that transformed one of the facilities you've worked in so far?
Maybe what quickly comes to mind is a project that I'm still currently involved in, and this is enterprise risk management. I don't know whether I mentioned I do risk as well, so I do risk and quality assurance. So the problem was that we had our previous risk management process. We were using very complex, overly complex risk registers, and staff awareness regarding risk management was low. There were many objectives, so this made it challenging for staff to take ownership at the departmental level in identifying, assessing, and even consistently monitoring risks. And you appreciate how important it is to do risk management. It's a new thing in currently the healthcare industry. And so what we did, the aim was now to embed a risk management culture across all departments, to ensure each department is able to develop and implement and continuously monitor its own risk registers. So what we did, we used the PDSA cycle. I think I mentioned that. That is a plan, do, study, act. It's a simple cycle, and I like it because it's simple, easy to apply. So on the planning phase, we identified the core issue, which was lack of awareness and training as a root cause. And that is what made there was a reduced ownership and understanding of the entire process. Staff found it too hard. So we formed a team that will run with this project. You said, so we had the overall committee, a hospital committee, then the risk quality assurance team to be the operators. We provided comprehensive training, TOT training for the risk team, the quality assurance coordinator. They had prior sensitizations and on-job training, but now we did a more comprehensive training. Then from that team designed now the hospital-wide training program. That was on the part of the planning. Then on the do part, we developed a much simpler and user-friendly risk register tool, which is online and used by all departments. Then we trained champions. The heads of departments were trained first, then they identified champions in every unit. We conducted then the risk assessment workshops, where each department was able now to develop their own risk register. We also introduced now the quarterly monitoring. At that point, as we are training them, then we're telling them that they need to be monitoring these registers at a quarterly level. Then we also developed a risk management framework policy, because you need to also have the documentation that you can refer to, and you need something that will make sure that the project is integrated into the hospital. On the study part, like I've said, we introduced monitoring. So the two levels of monitoring by the QA team through what we call departmental quality assurance officials in these committees, which are there in every department.
Okay.
The second level, we have the risk registers, the risk champions now doing the monitoring of the risk registers. And on the Act, so we ensured that now we standardized practice by having now similar risk registers, which we could monitor online. And then we integrated risk reporting into management review meetings. That is on the Act part. So we've realized results. I think because of that engagement with staff during the workshop, we could, that one-on-one, we could be able to at least impact them better, improve awareness, and resolve whatever issues they had. So we are having a culture shift and more uptake on matters of risk. Also, is something I may want to add is that the risk management policy also defines the roles and responsibilities of all the teams. So that is making uptake of risk better.
Yeah.
So that's what I can say in a nutshell, yes. And we have realized some gains on that.
Fantastic. That's really good. Well done. Well done on that project. Risk is normally something that people put to the back burner because like, oh, we have so many more problems to deal with. Why are we looking at risk right now? But I mean, risk is a way of, I believe strongly, it's a way of bringing a multi-pronged approach to improvement. So while you're dealing with the situation or the issues that have already arisen or that are being identified, you can also work proactively. You can also look at those that have not surfaced, that have not bubbled up to the surface yet, but are still like undercurrents that are coming up, that are there's a risk of these things happening. And we're generally having this shift, even on the ISO level, to risk-based thinking and the likes, help healthcare professionals and the healthcare industry to hone in on solutions and on improvement strategies before even the realization of the need, so that we become, proactive and do and provide the better services for our patients. Thank you so much. You mentioned something that is really, really key. I find to be key. You mentioned that you have you identified that the risk assessment and management protocol that was in place was becoming cumbersome. It was becoming a little difficult for people to adhere to, right? So now looking into detecting want to now sit into identifying quality improvement opportunities like you had identified. What are some indicators? What are things that people need to look out for that signal the need for an improvement project to be deployed? So you did mention that you saw that it was cumbersome, that the quality improvement, the risk management methodology or system or deployment was already being cumbersome. What are those things that had signaled before you honed into that okay, we'll do risk would have to improve on this risk, do a QI project on this risk management protocol? What are some common indicators, that signal within the system that show that, hey, there's an opportunity for improvement here?
Okay. I think in the first place, you need to have some well-defined key performance indicators. And there are some common indicators which are common in the healthcare setting, such as the ALOS, the average length of stay, the TAT in the diagnostics, hospital-acquired infections.
Yeah.
So this should be routinely monitored. And when you're monitoring this, then when you start noticing that you're having levels which are not good. For example, you could have also things like increased customer complaints. in your HR department, you're checking your staff morale, and you notice that you're having a high turnover, your retention rate is not good. There are indications of staff burnout. On the clinical side, you have high rates of patient safety incidences, such as increased medical errors or falls. So those are triggers that can tell you there's something that is amiss, that there are some inefficiencies in your system, or there are bottlenecks in the workflow. So those are the ones that would trigger. So I would start by saying that it's important to have KPIs which are being monitored, because when they are off, then you're able to now have an indicator that will tell you now you need to start to think of a quality improvement project to address those areas that are having issues.
Fantastic. So it is key that indicators are being monitored. It is key that we are getting data, that we're gathering data, that we're putting them together somewhere, so that when there is a shift upward, or we have a trend, or we have, we can see the patterns as they move and come in and go out. Sometimes even month on month, right? Or year on year, there can be patterns. And then you say, oh, this has happened for 2 years running in August. Hey, this is a 3rd year running in August. Let's, try and prevent. Why does this happen in August? Every August, why do we have higher incidence of patient faults or medication-related errors, etc.? How do we, and then we identify that as an intervention or an improvement opportunity? Thank you so much. Now, you talked about data. And I'm going to ask this question in, shall I call it in 2 ways or more? I'm going to merge 2 questions together. Now, what kind of sources of data should organizations use to detect these problem areas? And how do the frontline people who are engaging with this data, how are they able to identify the gaps? How can they contribute to identifying these gaps? And then what data should organization, should they look fully at just the complaints, or just the audits, or just the outcomes? What are the sources, where, and how do the frontline staff, or how do any staff within the system, so that we don't just place it on the laps of the team members who are interfacing directly with the patients? How can they contribute to identifying these gaps? How can every staff member contribute to identifying gaps? And what data can they bring in? Can we bring in to detect the problem areas, in addition to what you said earlier?
Okay. Now, when we talk about data, there are 2 types of data. You can have qualitative, and it can also be quantitative. And a lot of what I alluded to earlier is mostly quantitative, because you're measuring. But let me also add that sometimes you can also use qualitative data. And by this, I mean, when you go back to identifying the quality improvements, for example, the quality teams, you need to be having things like Gemba walks or 5 Kaizen walks, and you're able to observe the work environment. And that can also give you some information that you can be able to, that can trigger a quality improvement project.
Yeah.
You can also look at things like there's inconsistent care across units. You find that there's disparity in the same organization. One department is performing than another department. So it's good to realize that when you talk about data, it's not just the what you're measuring, but also there are those qualitative elements to it. Okay, now when we look at what are these sources of data, the sources I'll talk about, you have like you have, we've talked about the patient, the complaints. Then you have you're measuring patient outcomes. Like when you have high fatality rates, you can have increased TAT. Those are the patient safety metrics.
Yeah.
Yeah, you can also be having incidence reports, the near misses. I mentioned about staff, feedback from staff. So if you're carrying out survey, employee survey, to find out how satisfied your employees are, and that will tell you how you're doing in that area. you're also looking at the wait times, the patient flow and resource utilization. So patient flow, like the
bed occupancy, yeah.
Let me also give an example, like the neonatal incubators. You want to improve efficiency, and so you can monitor. So that's also another tricky area, because the need is great, they're not sufficient. So you need to monitor how you're utilizing them. Even simple things like in the lab, even like blood, being a scarce resource. So you're monitoring your utilization. When you talk when you talk about data, also you need to be careful about your data being accurate. So how are you obtaining your data? The sources that you're using, is it manual? Do you have is it automated? Yes.
It's actually critical that we begin to explore moving into, no matter our systems. And when we talk about automated, I'm sure when we say automated, especially in resource constraint settings, people begin to think, there's no how I'm going to get that from our management, right? But I think we can begin to think early about, moving into the basic tools that actually we use every day, so that we can make this more objective, make our data we generate, or data that we acquire, more objective and more trustworthy, improve the validity of the data that we're using. Otherwise, if we have poor data sources, we would have poor quality of data. When we have poor quality of data, we would be off on a tangent, because it means we would not be addressing the right issues, or would be having the wrong signals, or going off onto a project that's either not ready, not relevant, or whose time has not yet come. Right. So thank you. We've talked a lot now about this. Just one more thing. You gave an example of an indicator being where you have disparity between the performance of one department to another, given similar backgrounds in the same organization. Now, how can leaders, we have a lot of leaders here, we have a lot of healthcare leaders here. How can healthcare leaders, foster a culture where the employees, the team members, the healthcare professionals will actively identify and report improvement opportunities without there being, this blame game or strife, or saying, oh, those people, they like to show themselves. Let me use some Nigerian colloquial language or grammar. They just like to show themselves, but actually where they say, look, we have opportunities for improvement here, without them thinking, without the team members thinking about it, or professionals thinking about it as, either trading of blame or highlighting somebody's inefficiency or the other. How can healthcare leaders really foster this culture of reporting, or of the identification and reporting of policy improvement opportunities?
Okay. Before I even go into that, let me start by saying that first you need to have an engaged team. You need to engage the staff. Because you cannot succeed on a QI project if the staff are not engaged. So you need to have methods that make sure that the staff all along are carried along, they're plugged in. So what I've experienced, or what I've seen to work, is to create teams. Number one, you need to create teams, and as many teams as possible. I like giving different teams different names. So you have quality improvement teams, you have champions for various things. Like when we talked about risk, we had risk champions, you have Kaizen champions, you have IPC champions. Then have committees. I also talked about committees within this department. So you have like departmental quality assurance committees, you have resuscitation committees, there are various committees. So you are making sure that every member of staff is involved in one way or another on matters quality. And then another way also, you give targets to staff, engage them by giving them targets, which can be tied to the public sector. We talk about performance contract. So they're tied to the performance contract, or they're tied to the appraisal, so that our staff knows they have to achieve this by the end of the year. And then have self-assessments within the wherever the department, so that now you involve them in the self-assessments. Then when you do things like when you have a problem and that you have identified, when you're doing the root cause analysis, involve the staff, encourage to report the errors, and have a no-blame culture. So the tone at the top is very, very important.
Exactly.
If yes, it has to be a positive tone, and you involve staff in the reporting. Don't blame them. It should not be punitive, and that way staff will be more willing to participate. So now, having that kind of a background or foundation, then how do healthcare leaders encourage staff? So you see, in the first place, you had to put in efforts to engage them from the get-go. And now you need to come up with reward QI initiatives. Now that you have it in the performance contract as a target, then the staff will be motivated to come up with initiatives.
Yeah.
So reward those initiatives. Then also have like team building activities where staff can go and just be able to at least not things to do with like burnout. At least they're able to relax and network away from the environment and bond with each other, so that you reduce conflict in the work area. Training is very important. Capacity building. I've talked about the tone at the top. It goes hand in hand with an open door policy, so that staff are able to report to the management the issues and also to consult. Something that I learned a while back, I'm still not so good at it. I'm trying to delve into it to learn more about it, is using technology in the sense of gamification.
Gamification, yes.
Yes, the tools that you use when you come up with tools that we use. Let's not be so old school.
Rigid and old school, and boring.
Yes, so that now staff are able to, those reporting tools, let them be interesting. Yeah, something that
yes.
Gamifying, perfect, yes. So that now it's interesting for staff.
Yeah.
Then encourage regular feedback. Get back to your staff and find out how they are doing.
Yeah.
In a nutshell, I would say those are the things that I think healthcare leaders can use.
Yeah, fantastic. I love the smile on your face when you came to gamification, and I smiled as well. And I'm sure many people also smiled as well, because I mean, who doesn't want to be able to? Everybody plays games, right? One way or another. And the easier it is, the more something feels like a game and less like work, more like play and less like work, you understand how all of these hormonal triggers and feeding into the blood system of all of the different hormones that we need to keep us happy, and the dopamines and everything, when once it just looks less like work and more like fun, people would actually engage in it. Thank you so much. That is spot on. Yes, I am remembering that right now. Thank you so much. So we've talked a lot about detecting. Now let's look at designing, right? When we look at how to design. So we've talked about, and yes, thank you, Asteria. I saw your question, or I've seen your question. Let's keep the questions coming in. Would address them towards the end at the Q&A session. But if you have a burning question that we can take in, like is related to what we're talking about at the point, I'll just ask Anne immediately, and then would go get along with it. So let's look at design. Some people might say, hey, even without data, I can see the problem. I can see the opportunities for QI in projects. I see, in fact, there are so many, I don't even know which one to start from. That's my problem. So yes, I should get data. I have data. I should engage people. People are ready to do it. Everything you said, we've got it on lockdown. The problem we have is, how do we design it? Where do we start from? What are we going to, how are we going to, what is going to be effective that will prevent burnouts, that will prevent us from going in cycles or in circles, that will prevent us from running off on a tangent after we've started, right? So now that comes to what key steps should be taken to design it? Like the ABCs.
I would say number one, define the problem clearly. Obviously, like you have already stated, you will find that there are many problems that are coming up. Probably there are audits, and the audits have pointed some non-conformities. You have in complaints, you have incidents reports.
Yeah.
So you just need to, I would say, bite what you can chew. Yeah, look at you can the Pareto, the 2080. At least pick one problem that you know when you solve it, it will you will realize more gains, but also it's something that is achievable within a certain time frame. I prefer looking at within a year, carrying through a project within one cycle of a financial year. So first, clearly define the problem, and you can use tools like the 5 whys so that you understand what is the underlying cost, so that as you start your project, you're very clear on what it is that you're solving. Then number 2, you set measurable goals. Now, at this point, when we talk about when you are defining your problem, there's something that I like to use. Come up with a simple tool, and the simple tool is just a manual template where you have at the top there you have indicated what your objective, your main objective is. Then now you come up with your measurable goals, so that now your project, just identify the key steps that you're going to take, the goals, so that now, and the second, the other column will be now, what are the activities that tie up to each of these goals. Then you need to have a team. Identify the team that you'll be working with, and it's best to have a multidisciplinary team. Yes, it's best to have a multidisciplinary team. What I mean by this, let's say, for example, if the problem is in, let's say, radiology department, you could have the radiographers, the radiologists, you can have the nurse, you can have the medical team, because radiology has a lot of students. You can have someone in the health records department. You can have finance and maybe supply chain and even IT. So you have a multidisciplinary team, and even the physicist, because of the radioactive materials and all that, radiotherapy. Yes. So have a multidisciplinary team, and so that's where you'll be able then to look at, you'll be able to address all aspects of your project as you go along, so that you're not adding people the course of the project and they don't understand where you started or what it is that you want to do. Now, analyze the current problem that you have, and then of course you have come up with the solution, and that's what will inform the activities that you need to take. Then you do go into the implementation of the interventions. So each of the players assign roles. What is it that they're going to do in each of the intervention phases, so that you know who is doing what. Then communicate the initiative clearly, so that everyone understands their role and what is expected. Define what you need. If there are resource needs also, you need to define for each of these activities, what are the resource needs in terms of staffing, in terms of equipment, in terms of training. And that's why I said at the very beginning, determine if it's a project that you are able to handle within the
within a year.
Yes, within a year. So, and then of course now you need to monitor progress, monitor and evaluate the progress. So as you're going along, you need, we talked about KPIs. So also define your KPIs, so that you know what is it that you're monitoring, that will tell you where you are at. And of course, for you to be able to monitor, document, so that you have data. that tells you whether you're moving closer to achieving what you set out to achieve, or you're not achieving anything.
Yeah.
As you're monitoring, you're able also to tell where are you at quarter one, where are you at quarter two. You can already tell whether your project is actually working. Is your solution talking to the problem even before you come to the tail end of the project? So monitoring is very important. Then I would say finally, if your project worked, if whatever you implemented worked, then you need to scale it.
Yeah.
Remember that disparity that we talked about between departments. So if you're piloting with one department, and there are departments that have a similar process or procedure, then you can be able now to scale it up to other departments. So, yeah, those are the steps that I would say.
Fantastic. Thank you so much. So setting the objectives, identifying the goals, analyzing make sure they're measurable, keeping the time frame nice and short. Well, 1 year is not short in many circles, but yeah, keeping it nice and realistic. Setting up a multidisciplinary team so that the spread can be done effectively across the healthcare organization, so that we don't see that gap widening where you have people, this project is happening here and then it's not happening the other side. Yeah. So and then monitoring, like you said. Thank you so much. I trust we're finding value in this, and I hope we're having answers to our questions. Thank you, Anne. Now I'm going to move very swiftly to something that is, maybe let me call it like a snag, right? When it comes to designing quality improvement initiatives. So you talked about getting a multidisciplinary team, knowing the resources that you would need, and setting up, understanding the goals, making sure that the goals are measurable and all of that. Now, we have a lot of stakeholders. We have the management. This name management, I hear it a lot from my clients, and I just smile every time. Like, we have the management, we have other team members, we have clinicians, we have other support departments who don't even know or can't even be bothered more by what exactly you're saying. Now, how do we get a buy-in from these key stakeholders? The management, the support units. So you're looking at finance, you're looking at logistics, you're looking at all of the other support units are not core service delivery within healthcare. How do we get a buy-in from these people?
Okay. First, as a quality manager or the quality team, you need to first understand the strategic direction of the organization. What is in the strategic plan, so that you align yourself, so that you're not trying to sell apples to people who are more interested in mangoes. Yes, so you need first. Yes, so that now even whatever you're going to propose to the management aligns the strategic direction of the organization. And it's also very important that you talk about to the top management. Remember, they are interested also in the bottom line for the organization to be sustainable. So the way you pitch a quality improvement project, you need to be cognizant of that. So do your calculations and see, are you going to increase? What is the return on investment? What are the benefits? Is there going to be some increased revenue generation, or are you reducing waste? This will be interesting to the top management. How or are you going to enhance or to optimize the use of resources? So, and again, another thing is that you need to regularly engage leadership in discussions about quality goals, so that they're interested in what is going on. But start with what is it, the strategic direction of the organization. then show evidence of success. And I would say involve senior leadership early. Involve them early. Wait until you have started your project. Now you're talking to them when you're stuck and maybe you realize you need some finances. So talk to them early so that now from the get-go, they are aware of what is going on and there's that buy-in and there's ownership.
Yeah, thank you so much. Start early. I cannot overemphasize with you. Start early to engage the senior leadership and make sure that it's able to interpret how all of this grammar that we are speaking, how does it affect the bottom line? At the end of the year, what are we going to present to the board members, as a positive from investing in this quality improvement initiative that we have come up with. This is in the minds of the management. Now, there's something I always just to add a little bit up to what you said. There's something I love to say. I love to say, when you have data, you don't need to talk too much. So when you're trying to get buy-in from stakeholders, make sure you have data. When we have data, we've collated data, we present it in a way that is clear. We use infographics, make sure that it is clear and understandable by everyone, including the CFO who is going to be sitting there, and and tie it to the bottom line, like Anne said. How does it affect our bottom line? How are we going? What are we going to? How is it going to improve our revenue, reduce our waste, increase our profits, reduce our waste and our expenditure, and increase our profits? How is it going? So get data. When you get data, there's a lot of, you don't need to talk too much. Then that happened in that unit, and the other day that one happened, and the patients are not happy. It becomes subjective. Everybody's looking like this. But once you have data, I can present infographics and then a few testimonials, a few, maybe word for word with permission, with consent gotten. You have them. You have the stakeholders. You have the leaders. So, Anne.
Yes.
You mentioned something about we talk now about profitability and the bottom line.
Yes.
We have participants here from across Africa. Resource abundant, resource managing, resource constrained settings, what strategies, and I think Kenya is doing pretty much better than quite a number of economies, looking at it from particular metrics, not all metrics, and every country has their strategic advantage. What strategies can we implement to ensure that these initiatives remain feasible, especially for and sustainable, especially for resource constraint settings?
Okay. So number one, you need to prioritize well. Yeah, you need to prioritize as you're using as you're setting your QI project. Focus on those areas that will reduce waste, like I said, because already we said we have resource constraints. So focus on reducing waste. Then you need to leverage on existing resources. Use what you have. I mentioned at some point that you may be collecting your data manually, which is okay. If you're able to automate, then work with what is available. So you can still do have manual systems and still be able to do a quality improvement project. So work with what you have. You don't need to automate if you're not in a position to do so. Then you can also as existing infrastructure. So utilize current systems and technologies rather than investing in new expensive tools. For example, if you can just use the manual, what I've talked about, the HR records, then collaborate with local organizations. You can partner, and in the public sector, we normally do the public-private partnerships.
Yeah.
Yes. So even locally, you can partner with probably even a local university for research or training programs. and utilize those to collect, to get data that will inform quality improvement projects. And so you can also have, you can process re-engineer. You rework existing processes so that you won't need any major investments. Yeah, you can also focus on like maybe behavioral interventions. For example, when you're sending reminders to staff to follow maybe the hand hygiene processes, maybe you introduce a checklist for surgical procedures to prevent error. When we talk about quality improvement projects, it doesn't have to be those high-end projects that cost a lot of money. Yeah.
Yeah. Thank you so much. So this is letting us know that we don't have to wait until there's an evidence of a budget allocation for quality improvement initiative before we start. We can just start.
Yes.
Once we identify an opportunity, let's take it, let's seize it, and see what can we do, ensuring that the fundamentals are obtained, the data is gotten, that you're on the right track, and you have the right team, multidisciplinary team to execute it, and you have the champions. And I really like when you say you have different languages or different nomenclatures for different teams, because for one of our clients, we have those teams already. We have champions, and I'm like, oh, they are champions, and we are, I don't know, where everybody just sits with your own, I like to call it chieftaincy title. Just sit with your own title and do your own work assiduously there, right? Yeah, so thank you so much for that. Now, coming into we've looked at the detection, we've looked at the designing. Now, looking at the deployment into the sustainability of this, and we're coming to the home, we're on the home run now. What common challenges are there? Now we've designed it, we've detected, we've designed it. What common challenges should people expect? What common challenges have you encountered having worked with improvement projects and actually now leading the team for implementing improvement projects in Kenyatta National Hospital? What kind of challenges are common? What should people expect that will be a challenge that they would encounter, and how can they be overcome?
We talk about okay, when I say we, it's because I don't like using that term, but it's a term that I hear used a lot in the quality team by other people. Resistance to change. I don't know if it only happens in Africa or it's all over, and I don't know if it happens to other countries or it's just in my country. Resistance to change. Yeah. So I like to look at it as not as resistance to change, but people don't know any better, or that when you do not understand something, then they can't help it. Sometimes they're not even aware that they actually are behaving in a manner that can be perceived to be resisting. And what encouraging my team, so the people that I feel are, let me use in quotes, resisting, is that it is it's difficult, not because you're incapable, but because it is something that you're unfamiliar with.
Yeah.
It is difficult because you are incapable, but because you are unfamiliar. So it can be a barrier. So it's something that you really need to deal with, because if the teams are perceived to be resistant, then the team that's thriving, the lead team, may feel discouraged. So it's something that needs to be addressed. Yeah. So you need to, and this can be addressed by clear communication. Mentor. In quality, you find that you do a lot of mentorship, a lot of coaching, a lot of demonstration. Demonstrate what it is that you want the teams to do. You need to train a lot. You need to support. And So you are a mentor, you're coaching, and you're training, and you're providing that support.
Yeah.
Now, that key thing, that a challenge that we face a lot, and this one is real, is on resources. What was alluded earlier, inadequate resources, and not just the funding, but even time. Remember, you're dealing with the clinical teams, which are already bogged down with the patient work. And now you're coming, it's perceived like you're giving them more work.
More work.
So that, and you're giving them more personnel. So yeah, that is something that you need to deal with. So that's where we talk about leverage on existing resources. Okay. Yeah, like use the existing tools. Don't try and come up with too many new things. Just work with what you already know. Work with what, if you had, even for example, even the teams that are, you have already set this many teams. You have a quality improvement team, you have a 5S Kaizen team. So if you come up with a new project, don't create another new team. Rather, at which team that is already existing that can take up this task. Yeah. So that it will be easier for them, and then prioritize your resources, because you're having inadequate resources. So just prioritize what you have, and don't be afraid to seek external support. What we talked about, partnership. If it's a big project and it is very necessary, then you can explore grants or maybe partnership, collaborate with other healthcare organizations. Let me just use an example. Like in the lab, if you're not able to do, let's say, the EQAs, then can you do comparisons with labs that are doing EQAs, interlab comparisons?
Exactly.
If you cannot afford can you do an interlab comparison with a lab that is already having EQAs? So then another challenge is again is on data. Is your data valid? Is it because if your data is it's not automated, it's manual, then you may find it's not reliable. So you may need that also can pose a challenge. Or maybe it's not adequate because, like we said, the staffing issues, so probably they're not collecting data real time. So you find you're not having, and you're using this data to monitor your projects. So that can also be a challenge. Data collection, do you have adequate capacity for analysis? But to counter this, I would say use simple metrics. Again, work with what you have. Clear, simple, relevant matrices that you can be able to track progress. Then train properly from the onset, so that they are able to collect consistent, accurate data across the departments. I would say also communication. Yes. Who is communicating? Who is communicating what? Who is the leader? Yeah. The teams need to have a leader, and the leader has to communicate clearly. You establish channels. But again, we say encourage open dialogue, so that it's not just the leader giving directions and the people are not allowed. You don't get any feedback from the people. Even when things go wrong, as a leader, you're not aware of what is going on. And encourage regular feedbacks from the teams, not just the data collection, but have meetings to check how you're doing, the progress. Are there any setbacks? Are there any success? The quick wins, and celebrate them as you go along. Yes, I would say those are the ones I'll pick for now as the top ones.
Fantastic. Thank you. We are slowly running out of time, but I want us to touch maybe 2 or 3 questions finally before we take the questions that have come up already. And thank you for that communication part, because communication is the core, is the center of everything, from the from the identification of the quality improvement initiative or opportunity to everything revolves around the communication. And when I talk about communication, let's talk about communication in the let me call them 4 W's. Okay, the who, the what, the how, the W's at the end, and the when. Okay, so who are you communicating to? What do you have to communicate to them? How is it presented? And when? What's the timing that's presented? So thank you very much for highlighting that communication. And then you've actually touched the next question that was going to talk about data. But there's one part of it that I would like you to just briefly touch on. From your experience, how can the data be best analyzed to ensure the sustainability? Okay, so let me merge that with the next one. Okay, how can we analyze the data, and then how do we ensure that it's sustained beyond this initial deployment and win phase? So we deploy it, we win at it. How do we ensure that we're able to sustain it? How do we analyze the data and keep tracking it to make sure that we win at it, that we sustain the wins?
So I would say first establish clear data methods. Okay, so that now you have effective data collection. So at first, be clear on what data will be collected, how will it be collected, and who will collect this data, so that you ensure consistency and accuracy of your data. Then use standardized tools. Like I said, if it is a manual, then is everyone using the same type of tool, so that you're sure that you are collecting your data is similar. And then also I would say collect both quantitative and qualitative data, because it will be useful when you're analyzing. You're not just having numbers, but you're also able. We said at the beginning, when you're talking about defining quality, we said you need to, in healthcare, you need to also understand the patient experience and the staff experience. You will not know that by just numbers. You need also to be able to collect the qualitative data, because that will offer deeper insights into the human aspects of care. Now, you talked about how you handle this data. So I prefer having a visual tools that you can use. So you're able to visualize it. And if you cannot be able to automate simple things like even descriptive statistics, the graphs, you draw the graphs, they're able to see the trends, the pie charts, they're able to see. So even if if you're able to have automated tools, like you can use the dashboards. But if that's not possible, then just use the simple descriptive statistics, the graphs. In lab, we also use the control charts, and we draw and bring that to staff, and they're able to track that over time. So then we have the Pareto charts, so that what is causing most of your problems. The 20-80 rules. So yeah, descriptive statistics, trend analysis, those kind of things. We talked about root cause. It's also root cause analysis. It's also a way of also analyzing your data.
Okay.
I don't know whether
yes.
I've answered your...
Yes, you have. Yes, you have. Yes, you have. All right. Thank you so much. Okay. And the good thing about the way you've answered is that you've taken on a number of other things that may have been burning as questions in the minds of people, and that we also had as questions. But I'm just going to skip to a penultimate question. Now, after this has been done, executed, let's say spread, okay, we've been able to deploy it across different units. We're seeing and I mean the improvements happen. what is the relevance of evaluation? And then I know that we have external evaluations where you have people who come in from the outside who are external to the system and come in and evaluate your quality improvement, you know, especially when people want to publish or write about it. Okay, you have, there's external evaluations done, and then you have this highly embedded evaluation where people who are within are evaluating, the system. First of all, is it even relevant to evaluate your quality improvement or your quality improvement projects or initiatives? Is it really, is there any reason? After all, it's for your work, it's for your patients. Is there any need to evaluate it? And if yes, which is more effective, having people coming from the outside to look at, what you've done over time, or, having that highly embedded evaluation where it's done from within? What has worked for you?
I would say both have their place and both are important. First, let me start with the internal evaluation. The internal one, it makes the organization own its process. And when I talk about internal, I look at it in two levels. There's for an accredited or a certified organization, we have the internal audits, and which are driven by, let's say, the quality assurance team. But then we also have departmental self-assessments. So you will find mostly you will start with the quality audit because it's a quality team that will drive the process. But then over time, it's good to have self-assessment so that the departments own their quality management system. I prefer to call it the DQMS, Departmental Quality Management System. So the smaller quality management systems. So you have the self-assessments, and they help the department own the process because they will identify problems and close those gaps. Now, this time, since there's no fear of reporting, it's amongst themselves, no one is going to punish them, then they can be very open. And then now you follow up with the second layer, the internal audit. So I would say both internal and external have their place. But then the external audits, these are mostly the third-party audits, the evaluators. So they're important because they are able to provide a more objective and independent view. Maybe there are some areas that the internal auditors missed, but an independent and an external audit will be able to highlight this. And also it helps in comparing with peers. How are you performing in relation to peer organizations? So if you're only doing internal audits, you may never get really to know how you're performing in relation to peers. Yes, and so there's that aspect to it.
Yeah. Okay. Thank you so much. So internal and external, you have to find a way to get people from the outside to also look inward so that you're not blindsided to the gaps or the things that you have not covered or the things that could have been done better. And then it is vital to use the internal, to the highly embedded evaluation method that helps you to own the system, own it fully, own where the gaps are, own what the opportunities for improvement of the quality improvement opportunities are. Fantastic. Thank you. So finally, somebody is here. They've heard about detecting, they've heard about designing, they've heard about deploying. Now, what should they do now? What are the first steps that they can take now, okay, to start a QI project in their facility? What can they do now? What can they do tomorrow morning?
Wow. I would say, for me, the first thing will be look at your, what is it that you're, start with where you are. What is it that you're monitoring already? Because you'll find in healthcare, we are always monitoring something. What is it that you are
Yeah.
already monitoring?
Yeah.
Yes. So what are you already, what those KPIs that you've already established? Because start from where you know. Analyze that data. What is it telling you? And you can compare that with, for example, if you're already monitoring hospital-acquired infections, where are you at? What are the trends? Are they increasing? Are they reducing? How do you compare nationally? How do you compare internationally? Start with, so identify, first assess and identify a focus area by looking at the data that you already have. Analyze that data and see what it's telling you so that you are able to identify a problem already, work from where, with what you have already. So select a specific problem or process to target, ensure it is, and as you probably you look at your data and find there are several problems or several issues. Find one that is aligned to your, I talked about the strategic plan, I talked about the strategic direction, so that you get the leaders. Yeah? So identify, you identify like 3 problems or issues. Look at which one is closely aligned to the strategic direction. Then start focus on that. The number 2, assemble a team. Assemble a team, and assembling the team, ensure that you secure leadership support, because you need to have leadership support for your for your project. So secure leadership support, and there's something that I mentioned, that make sure that your team is multidisciplinary.
Yeah.
Make sure that your team is multidisciplinary, and ensure that you have leadership support, so that you have you'll have resources, you'll have authority and encouragement for the project. If you leave leadership behind, those 3 things will be left out: the resources, the authority, and encouragement. You know that you're sure that you are aligned to the strategic direction, and there's ownership from the leadership. Then number 3, now come up with your clear plan. So convert now your issue or problem into a clear objective, and like I said, have that tool now, so that now you have the, what is it, make it smart, turn it into a clear objective. Make sure it is very specific, measurable, achievable, it is relevant and time bound. The relevant part of it, you said it's aligned to your strategic direction. What are the timelines? Is it achievable? Bite what you can chew. With the resources that you
Bite what
have.
you can chew.
Yes. Then measurable. Define the KPIs that you're going to use, and then be very specific. So those are the 3 steps that I would say would be the key steps with that.
Awesome. Thank you very, 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 very much, Anne. Thank you. Please, let's give it up in the chats for Anne. Thank you. This was an amazing time. It's an amazing time. You shared a lot, and I mean, it was just nice and engaging, and seeing that, there's a lot of overlap between, we're able to just carry on our conversations like that. It was just beautiful. Thank you for sharing from your experiences. We have quite a number of questions with very limited time. First of all, I want to request, please, for us to just give us maybe another 10-15 minutes tops, so that we can just cover the questions. I'm just going to ask questions that I think have not been covered. Someone asks about a tool for documenting the actions for monitoring the risks. We can come up with this and share in the future. Somebody asked for your contacts for consultation. Now, someone says, how can you use the quality indicator to improve the laboratory or healthcare system? I think we've talked quite a little bit, or quite quite graciously about the quality indicators for improving the system. But do you want to just touch on it in about 2 sentences, just to answer the question, how can you use the quality indicator to improve the laboratory or healthcare system? maybe more or less a recap. Let's say she didn't come in too early. He or she.
Okay. So we club, like I said, when you're coming with quality, when we define quality improvement, we said you need to have the context in mind.
Oopsie. Just give it a sec. Let me find. I need to mute. Why can't I find our participants? Okay. Okay, it's tricky. I'm not seeing the person. Okay, I found the person. Yay. Okay, go ahead now.
Okay, so I was saying, so the quality indicators in lab, you'll probably be looking at the turnaround time. You'll be looking at the rejection rates, probably of the sample rejections. You'll be looking at if you're in transfusion, you're looking at the transfusion, what do you call it? The errors. You're looking at your EQAs, how many EQAs you have passed or failed. You'll be looking at even the non-conformities from your audits. So yeah, so you're looking at when you do the staff competency tests, how they are performing in their assessment. Of course, there is also the patient feedback. The components that we talked about, the controls again from the QCs, the internal controls, how they are performing. So that's what would inform your quality improvement project in the lab. I had alluded to doing in interlab comparisons if you're not able to do QA. Probably because if you find that you're not doing so well in your internal quality controls, and you suspect that there is a problem, you have these controls that keep on failing and all that, and then an interlab will be able to tell you with a lab that has similar equipment and a lab that is already doing an EQA, will be able to tell you where you are at. Yeah, even before you are able to maybe do the certification or the accreditation.
Yeah.
So I would start with what you're already monitoring, and then grow from there. Yes.
Okay. Thank you so much. I hope that helps. Who asked that question now? Charles. I trust that helps. Because someone was asking on sustainability, but I think we touched that a bit to keep it sustainable. Thank you very much, Anne. And there was something you said, and you said again, which is about partnering with other organizations.
Yes.
And this is something that we've actually seen is pivotal, in healthcare. We really can't walk alone. And even in Africa, we don't have we work a lot in a communal with a communal sense of community, right? What is normally called the Ubuntu sense of community, right? Where we think that everybody should just lift everybody together and all of that. And there's something interesting that we found at QBS Global. We found that over time, it's very, very challenging to help to help so many organizations, holding them one after the other to execute, to understand all of the strategies that we've talked about for the past hour and a half, and execute them, and just guide them into, okay, you're on the right path, you're not on the right path, and just rephrase, reframe, re-strategize. It's so difficult. Someone is asking for your contact for consultation. I mean, there are only so many people. If we're going to ask all 20-something people who are left right now to, share their contact so that it will be impossible for you to handle all of them. And so we came up with something in QBS Global, where we are building a tech-driven platform to help organizations come together at their levels, at different levels. So everybody is at this level of ideating or detecting a quality improvement initiative or trying to implement quality management systems. It's okay, we're all at this beginner level and everybody together and helping them to drive, but tech driven, okay, where you can have the resources, where you can have the templates, the tools, the vendors, and so many other things that are needed, right? Just bringing them together and helping people to be able to assess these things together. And we're building that. I mean, I'm very, very excited about what's coming up. We're building it with a team of technology, the people who are core into tech, you know, and all of that. But like you said, we always need data. You know, in fact, I even want to share, let me share that window. We always need data. We always need data. Without data, it's difficult for us to come to a place where we are able to see where exactly have we gone or where exactly are we? Okay, so let me just present this so that we can see it, right? It's very difficult to come without data, and so we've come to a point where we desire to have this data from people. You say, let us know what the challenges are. What has been your experience in implementing quality improvement? What has been your experience? Share with us your experience, and with the experience, with the data, we can frame properly this initiative where we onboard, you know, several organizations, where organizations come together and say, okay, we're all at the same start, we're all at the same point together. What are you doing? Okay, you're on EQA, I'm not on EQA. Can we do an interlab, all 7, 10, 20 of us? Okay, those of us that are doing EQAs, we're having challenges interpreting, and you know, this talking about medical lab now, interpreting, or you know, building our system around, improving our system around the results that we're getting. How do we improve on this? Let's come together, you know, just driving these things. And some people are talking about improving the average length of reducing the average length of stay within the healthcare, within their healthcare settings, and just bringing people together at the different places. So I would like to crave our indulgence, as many of us who are here, to, you know, scan this QR code or use the link in the chat. The link is going to be shared in the chat by one of our team members right now. Just use the link in the chat or scan the QR code and just help us with data so that we can build something that will that would improve healthcare across Africa. And what's in it for you? You will get access to our research findings. You will be among the first to be onboarded, not bees, but be onboarded on the platform. And then you will, I mean, when we're on board, of course, you're having all of the access. You're going to be the first, you know, what's called beta testing, stage of testing. You would be able to use all of this, the resources and, you know, the templates, SOP development, document management, all of those things will just be there. And we look forward to having our data, our information. Also, would really want everyone to fill in the feedback form. The feedback form is going to be shared right about now as well. Fill in the feedback. Let us know how the session was for you. Before I ask Anne to share her final thoughts, before we say goodbye, you know, let us know how the webinar was for you and what else you'd like to see, and all of that. Okay, so I'm just going to run through this and let us know that we have some courses coming up in April, in May, in June, and we also have certification courses. Remember that Anne said Anne is a certified lead auditor, ISO 9001 2015. I also am a 9001 2015 certified lead auditor, and we have these certification courses available for you to take, especially if you are already in the field of quality and you're already auditing. You can do your certifications across, I mean, we're talking to healthcare professionals now, but we actually have this across different domains on different industries. But here we're having this, you know, for us across April, May, and June. We deployed this course in Lagos, and it was an amazing 5 days in Lagos. That was in February last month, and in May it's coming up again, this time around in Abuja. I'm letting the cat out of the bag now. It's happening in Abuja, May 5th to 9th. And at the end of the month, we have a 1-day course on document control and SOP writing. And then we're coming back into the laboratory in June, March, April, May, we're going out of the laboratory, and then we're coming back into the laboratory in June to talk about laboratory health and safety practices. Okay, we might go a little bit into infection prevention and control, but yeah, let's see how it goes by then. So thank you all for your time. This is about the end the April course, but thank you for your time. Here's the QR code for the webinar, for today's webinar. Please, fill it and let us understand how you've interacted or how the session has been for you today. And the link is going to be in the chat. Finally, Anne, let us know, what final thoughts do you have for everybody? What are your final thoughts around quality improvement? What are your final thoughts? What is that final word of advice that you would give to people seeking to make a real impact through quality improvement?
I would say always remember that quality is not a destination. It's a journey. And it's a journey of continuous improvement. So do not undermine the small steps, incremental. Yeah, it's important to continue striving for continuous improvement, and you refine as you go along. Number two is always have a patient-centered approach. Remember, at the core of healthcare is the patient. So whatever you do, have the patient in mind. Endeavor to improve patient outcomes and patient experience, and you will not go wrong. The final thing is teams. I said again, create teams, build teams, and empower your teams. Create that resilience among your teams for long-term impact. And as when matters teams, remember to celebrate their success, recognize them, appreciate them. So you're as good as your team. So yes. So in quality, you can't do it alone. Remember, we said it's not a destination, it's a journey, a very, very long journey. You don't walk alone. If you want to go very, very far, walk with your teams and you'll go far. Thank you.
Thank you so much, and thank you so much. I normally, when we have organizations come to us and say, okay, we want you to guide us in implementing quality management systems. How long do you think it could take? And I say, okay, let's do an initial gap assessment. Let's see what's happening, and we do all of that, and then based on that, we give, sometimes, I think the shortest we've given is about 15, 18 months. And then we have one that was up to 36. I'm like, 3 years? I'm like, hi. It doesn't happen in a day. It doesn't happen overnight. So yes, that's just to buttress what you said. Thank you so much, and thank you everyone for staying on to this point. We'll see again next month. And you can connect with Anne on LinkedIn. She's active on LinkedIn. You can connect with her on LinkedIn. You can ask questions. I think they can connect with you to ask questions. And and we're here for you. Thank you so much, Anne. It was such a pleasure having this conversation with you.
Thank you, Nene, for having me. Thank you.
Yeah, we wish you all the best as you lead the teams on the quality improvement drives in Kenyatta National Hospital. All right. Thank you. Thank you, everyone, for coming. Have a good evening.
Good evening, too.
Thank you. Bye-bye. Thank you, Grace. Thank you so much.